Recruit the CEO of Miami Cancer Institute, the founding CEO. We are developing a partnership with Memorial Sloan Kettering, one of the most honored brands and recognized destinations for cancer. And the medical head there, Jose Baselga, I called up to talk about enlisting his help in the recruitment of the next speaker. And Jose, after I said, Dr. Zinner said, haven't heard of him. And I proceeded to repeat, and then he said, did you say Michael Zinner? And I said, I did, Jose. He said, Michael Zinner. And I said, yes. I've never heard this in medicine referred to as by anyone. He said, do you know he is one of the most revered men in oncology in the world? One of the most revered men in the world. So with that, and the privilege of introducing him, I'm going to be very brief. His accomplishments are too numerous to count, as we would say in medicine. He is our current CEO. He comes to us about 9 years ago, where he was the head of the Dana-Farber Cancer Institute, chairman of the Department of Surgery of Brigham and Women's Hospital, among the most recognized in the world, and a professor of medicine. He served as a leader of the largest organization of surgeons in the country, the American College of Surgeons. He currently serves as the chairman of surgery for the Florida International University College of Medicine. But most importantly, he serves as our spiritual, medical, and emotional leader as we strive to conquer cancer in this community. There is none better to lead this effort, and again, most revered in the world, than Dr. Michael Zinner. Michael, welcome.
I was born and grew up here in Miami. I went to Coral Way Elementary School, I went to Ponce Junior High, and I went to Gables High School. And I'm very proud to be a Miami native. Not only that, my mother is a Floridian native, and my son is a Floridian native. Now, how many of those do you know in this room? Not very many. All right, so I went to medical school in Gainesville, so I'm a Gator.
Go Gator!
Hey. I trained in surgery at Johns Hopkins, and then I spent 6 years as chief of surgery at UCLA. And then, as Jack said, for the past 22 years before I came back to Miami, I was chief of surgery at one of the Harvard hospitals and also clinical director of the Dana-Farber. But I came back because I wanted to start something in my community where I grew up. And I wanted to start something in my community so that people never had to leave this area. When I was in Boston, surviving 5 years without cancer was around 30-35%. Fast forward to where we are now. It's about 65%. So look at the progress we've made in those 50 years. The biggest killer, unfortunately, is lung cancer. And it used to be that lung cancer just 5 and 8 years ago had, if you had stage 4, the advanced form, you had 5% chance of survival. Now that's jumped up to 25%. Dramatic changes that have occurred. When I was in training, we opened our doors 7 years ago. This is our anniversary month. Where 7 years ago, no one ever heard of us. We opened the doors, and I knew it would be a climb, and we had some projections that we would take 10 years to be profitable, and it would take 10 years for us to get known on the map, and it would take 10 years for us to see our 700 patients a day as they walk through the door. Let me tell you where we are today. So today, Miami Cancer Institute, we see between 13 and 1,400 patients a day. We're a profitable institution. Surgery, you cut it out. Radiation, you burned it out. Chemotherapy, you poisoned it. Now what's changed is our ability to add new forms of therapy. Now you've all heard of the fourth form, which is immunotherapy. And immunotherapy says, let's take your own, first of all, why don't all of us drop dead every day? It's because we have an immune system, and every time we breathe in some bacteria or a virus, instead of killing us, we've got an immune system that says, hey, wait, this is different than us. Let's kill that virus or bacteria. That's true for cancer too. So how come we develop cancer? It's because some of the failure of our own immune system. So what immunotherapy says is, how do I jumpstart our own immune system? And we've figured out ways of doing that. For example, let's take a drug like Keytruda. You've seen the CAR T cells, but really what that is it's a way of turning on your own immune system. So we've made tremendous progress.
How is someone who's a leader in this industry, Dr. Zinner, and not just you, I'm talking to the broad audience, how do we bring more attention and awareness to pediatrics so we get better outcomes? My son lasted 14 weeks.
So pediatric cancers are one of the toughest things we have to deal with. As I was going through school and training, I realized I didn't have the emotional stamina to take care of kids because I had my own kids. And the prospect of taking care of these, if you didn't get the screening, you'd show up to our doors later with a more advanced cancer. And sure enough, it turns out in breast, colon, and melanoma, we saw more advanced cancers after COVID because people didn't get screening. So what am I telling this audience? Do your screening. Get your mammographies. Get your colonoscopies. See your skin doctors, your primary care physicians, so make sure that thing. If you're a man, get your PSA done. With respect to children, it's hard because we don't have a lot of screening tests for the kinds of, it's diet, exercise, smoking, exposure to the sun. Those are some of the things. But the greatest predisposing factor to getting cancer is aging. And we are in an aging population here in South Florida. Now, a chance of curing you of that disease. So let's go back to what we talked about a minute. Screening is a critical part of that. And we still are in prostate cancer, still in the throes of what's the person ultimately going to succumb to? Their disease or the other things that come with aging? And that's a complicated answer, but screening is still a critical part of the decision. Cannabis, from Schedule 1 to probably Schedule 3, that probably will occur in the next year, probably in the next year. That at least will allow us to do the kind of trials and experiments on people that we've never been able to do before. So it wasn't exactly the question you asked, but it gets down to the same issues.
And statistics on vaping.
I have a mutation called P53, it's Leaf-Raumini syndrome. And I did diagnose children 2 years old and 5 years old with carcinoma. Carcinoma doesn't happen in children, happen in adults. So when you diagnose this child, then you have to remember, is this something can relate to the family? And now our guidelines, any child diagnosed with sarcoma, any kind of sarcoma, rhabdo or non-rhabdo, this child need to have a testing to see if they have any congenital. Comment on that?
Well, you know, he couldn't have asked a harder question to answer in 2 minutes. So first of all, I gotta explain what the blood-brain barrier is. We do have something in our head called the blood-brain barrier, and it prevents toxins from circulating in the blood, actually getting into your brain cells. And it's there for a purpose. I mean, whoever designed how well they will work going in the future. The 60 Minutes program that you may have seen last week was about Alzheimer's, and that if you focus this, open the blood-brain barrier up, and treat with drugs to get rid of the plaques that cause Alzheimer's, it looks like it might work. So there's a whole future ahead of being able to open up the blood-brain barrier temporarily, drive drugs into that area, and then it allows it to close again. And we fortunately, a couple of years ago, decided to buy one of the early versions of that, now the advanced versions of that device, and we've got that at MCI and Baptist, and we're going to be